So good morning everyone. I am Dr. Shanthini, Assistant Professor, Department of Anatomy. Today's class is on anterior and lateral compartment of leg and dorsum of foot. So let's see first about the anterior compartment of leg. So leg is a region between the knee and the ankle. So the important bony landmarks in the leg are, so we have two bones in the leg. Medially it is the tibia, laterally fibula. So medially in the tibia, we have two condyles. In the upper end, there is a medial condyle of the tibia and the lateral condyle. So, on anteriorly, we have a tibial tuberosity. From the tibial tuberosity, there is a border, sharp border called anterior border of the tibia, which is otherwise called as shin. So, we also have, so in the fibula, there is a head of the fibula. Near the ankle joint, we have two bony elevations. That is the medial malleolus and the lateral malleolus. Then we move on to the skin, that is about the cutaneous innervations of the leg. So the leg is innervated by several nerves. So anteromedially it is by the saphenous nerve. The nerve root is L3, L4. And anterolaterally aspect it is a superficial peroneal nerve, that is the lower part. It also supplies the dorsum of the foot except the first web space, which is supplied by the deep peroneal nerve. And the lateral border of the foot is supplied by the sural nerve. The upper part of the lateral aspect, it is supplied by the lateral cutaneous nerve of calf. So these are the cutaneous nerves which supplies the leg. So what we are seeing here is the cutaneous nerves present in the superficial fascia. So one is the infrapatellar branch of the saphenous nerve, skin, that is which supplies the skin over the ligamentum patellae. So then this is the saphenous nerve which lies along with the great saphenous vein. So it is seen on the medial side of the leg and along it starts from the medial border of the foot. So upper 2/3 lateral part of the leg, it is by the lateral cutaneous nerve of calf. Lower 1/3 lateral part of the leg and the dorsum is by the superficial peroneal nerve. So the next content in the superficial fascia is the cutaneous veins. The important cutaneous vein is the great saphenous vein. This great saphenous vein, it is a continuation of the medial end of the dorsal venous arch, which is present on the dorsum of the foot. So from this dorsal venous arch, dorsal metatarsal veins arises, which divides into two branches, that is dorsal digital veins. So this great saphenous vein, it starts from the medial end of the dorsal venous arch, ascends upwards. So in front of the medial malleolus, then it ascends along the medial side of the leg. So it is accompanied by a saphenous nerve. Then we move on to the next layer after skin, superficial fascia. Then we move on to the next layer, that is the deep fascia. So in the deep fascia, in the leg, it encloses the leg. The deep fascia encloses the leg and it also sends anterior and posterior intermuscular septum. So dividing the leg into anterior, lateral and posterior compartments. So what you see in this picture, so this is the tibia and this is the fibula. So this is a medial side and this is a lateral side. So what you see here, this is the anterior compartment and this is a lateral compartment. The yellow color is the posterior compartment. So each compartment will have muscle, vessels and nerves. So in the anterior compartment, so let's see one by one what are the contents in detail. So this is what you see here is the anterior intermuscular septum, which lies between your anterior and the lateral compartment, and this is the posterior compartment, and this is the posterior intermuscular septum which lies between your lateral and the posterior compartment. So we have two, anterior intermuscular septum and posterior intermuscular septum. So three compartments. So in a nutshell, the leg has three compartments: anterior, lateral and posterior compartment. Each compartment contains its own muscle, vessels and nerves. So in the ankle, what happens? This is what we have seen in the leg. The deep fascia is modified into compartments, that is the intermuscular septums. Whereas in the ankle, the deep fascia, it is thickened to form a fibrous bands called retinacula. So why we need a retinacula here? It keeps the tendons in place and it also prevents the bowstringing of the tendons during foot movement. So what are these retinaculars? In the front, we have a superior and inferior extensor retinaculum. And in the lateral aspect, we have superior, inferior and peroneal retinaculum. So in front, we have superior and inferior extensor retinaculum, whereas laterally, we have superior and inferior peroneal retinaculum. Posteromedially, we have a flexor retinaculum. So in and around the ankles, we have three retinacula, which are nothing but the thickened deep fascia. So one in the front, that is superior, inferior, extensor, that is the extensor retinaculum. Then laterally, it is a peroneal retinaculum, and posteromedially, it is a flexor retinaculum. So in the this is a picture showing the extensor retinaculum. Okay, so this is an extensor retinaculum, inferior extensor retinaculum, and this is a superior extensor retinaculum, below which or behind which the tendons, vessels, and nerves are seen. So what you see here is the peroneal retinaculum, and one more is there. So this one is your flexor retinaculum. So first we will see the anterior or extensor compartment of the leg. So anterior or extensor compartment of the leg, it is bounded. So it is bounded on the lateral side by the it lies between the anterior intermuscular septum. Okay, it is separated. This anterior compartment is separated from the lateral compartment by an anterior intermuscular septum. It lies on the anterior aspect of the leg. So what are the muscles seen here? One is the tibialis anterior and extensor digitorum longus and extensor hallucis longus. So these are the three muscles which are seen here. So tibialis anterior, extensor digitorum longus and extensor hallucis longus. Vessel seen is the anterior tibial artery and nerve is the deep peroneal nerve. So contents muscles, tibialis anterior, extensor hallucis longus, extensor digitorum longus and peroneus tertius. Vessels, anterior tibial artery and venae committens, whereas nerve, anterior tibial nerve, otherwise called as deep peroneal nerve. So what you're seeing here, all these are the muscles which are seen in the, and this is the anterior view of the muscles which are present in the anterior compartment of the leg. So muscles are front of the leg. So first we'll see about tibialis anterior. So it is a spindle shaped muscle and it is a multipinnate muscle. So it originates from the upper 2/3 of the lateral surface of the tibia and the adjoining part of the interosseous membrane and the distal part of the lateral condyle of the tibia. Okay, insertion, the tendon, it pierces the superior and upper band of inferior extensor retinaculum and then it gets inserted into the medial cuneiform and the adjoining part of the base of the first metatarsal. Okay, then it is supplied by a deep peroneal nerve. So what is its actions? Dorsiflexion of the foot and it maintains the medial longitudinal arch and it causes inversion of the foot. So what are the actions? Dorsiflexion of the foot and inversion of the foot. So the next muscle is extensor hallucis longus. So origin is from the middle 2/4 of the medial surface of the shaft of the fibula. This is from the fibula and also the adjoining part of the interosseous membrane. Whereas insertion, it is the base of the distal phalanx of the great toe. So this is a hallucis muscle, so it goes to the great toe, base of the distal phalanx of the great toe. Nerve supply, again it is a deep peroneal nerve and actions is extensor of big toe and dorsiflexion of the foot. So the third muscle is extensor digitorum longus. So origin is from the lateral condyle of the tibia, upper 1/4 and medial 2/4 of the medial surface of the shaft of the fibula. So it arises from both the tibia and the fibula and the adjoining part of the interosseous membrane. So insertion, the tendon divides into 3 slips. So middle slip insert into the base of the second phalanx, whereas the lateral slip unite and insert into the base of the third phalanx of the lateral toes. So nerve supply, again it is by the deep peroneal nerve. Action, dorsiflexion of the foot, extension of the metatarsophalangeal joints, proximal interphalangeal joints and distal interphalangeal joints of the lateral 4 toes. So except the great toe, all other toes, it will cause extension of the joints, metacarpophalangeal joints, proximal and distal interphalangeal joints. Then the last muscle is the peroneus tertius. So peroneus tertius origin is from the lower 1/4 of the medial surface of the fibula, adjacent part of the interosseous membrane. So the muscle then it gets inserted into the medial part of the base of the fifth metatarsal bone. So it is into the fifth metatarsal of the bone. Nerve supply as usual, deep peroneal nerve, and action is the dorsum of the foot and eversion of the foot. So that's all about the muscles of the anterior compartment of the leg. So applied aspects, anterior tibial compartment syndrome. So otherwise called as Shin Splints or Fresher's syndrome. So other name for anterior tibial compartment syndrome is Shin Splints and Fresher's syndrome. So what happens here? Because of overexertion of the muscle, this syndrome occurs because of the overexertion of the muscles, and it is common in medical students and the person who are recruited during army. So the freshly recruited army personnel. So these are the two people who get this syndrome, Fresher's syndrome, because of the sudden overexertion of the muscles. So there will be a pain. So the second one is the most common thing and most familiar one is a foot drop. So what happens in the foot drop? There is an injury to the deep peroneal nerve. As a result, the muscles of the anterior compartment of leg will get paralyzed. So the person will not be able to dorsiflex the foot. So the foot is in the plantar flexed attitude. In addition, there is a sensory loss in the first interdigital cleft. So this person will have difficulty in dorsiflexing the foot. As a result, the foot will be plantar flexed. So whenever the person walks, he will walks with a high stepping gait. So that's all about the muscles and its applied aspects. Then we move on to the anterior tibial artery. So anterior tibial artery, it is the main artery of the anterior compartment of the leg. So it originates. It is a branch of the, or it is a continuation of the popliteal artery at the lower border of the popliteus. So what is its course? It arises at the back of the leg, passes between the two heads of the tibialis posterior. Then through an opening in the upper part of the interosseous membrane, it enters into the anterior compartment. Then it runs vertically downwards up to the ankle in front of the interosseous membrane. Finally, it continues as a dorsalis pedis artery in the dorsum of the foot. So once again, I repeat, it is the main artery of the anterior compartment of leg. So origin, it is a continuation or it's a branch of the popliteal artery at the lower border of the popliteus. So what is its course? It arises at the back of the leg, passes between the two heads of the tibialis posterior, then through the opening in the upper part of the interosseous membrane and enters into the interosseous membrane, enters into the anterior compartment and runs downwards and up to the ankle, and in the dorsum of the foot, what happens? It continues as a dorsalis pedis artery. Relations. So relations within the muscles. So with muscles, with nerves. In the upper 1/3, it lies between tibialis anterior and extensor digitorum longus. In the middle 1/3, it lies between tibialis anterior and extensor hallucis longus. In the lower 1/3, the tendon lies between sorry for the disturbance. In the lower 1/3, it lies between the extensor hallucis longus and extensor digitorum longus. So this is the relations of the this is a relation of the artery with the muscles. So with the muscle, in the upper 1/3, it lies between the tibialis anterior and the extensor digitorum longus. In the middle 1/3, it lies between, you can see in the diagram, between your tibialis anterior and extensor hallucis longus. Whereas in the lower 1/3, it lies between the tendons of extensor hallucis longus and extensor digitorum longus. So what is its relation with the nerves? So in the upper and the lower 1/3, the nerve lies lateral to the artery. Whereas in the middle 1/3, It lies anterior to the artery. Okay, the deep peroneal nerve, it lies anterior to the artery. What are the branches? So branches are the anterior and posterior tibial recurrent arteries. So you can see here, this is an anterior and this is a posterior tibial recurrent arteries. Apart from that, we have a muscular branches. Then anterior medial and anterior lateral malleolar arteries. So these are the branches of the anterior tibial artery. What are they? Anterior and posterior tibial recurrent arteries, muscular branches supplying the anterior compartment of the muscle, anteromedial and anterolateral malleolar arteries. So the perforating branch of a peroneal artery. So this artery, it reinforces the blood supply of the anterior compartment, and this artery is accompanied by a venae committens. So what is venae committens? Already I have told. So a pair of veins accompanying an artery is called as the venae committens. So next, after muscles, after vessel, then we move on to the third content of the anterior compartment of the leg is the anterior tibial or the deep peroneal nerve. So this is deep peroneal nerve origin. It is a branch of the common peroneal nerve which is given at the neck of the fibula. So course and relations, it begins at the lateral aspect of the neck of the fibula. It pierces the anterior intermuscular septum and enters into the anterior compartment. Then it pierces the extensor digitorum longus and descends down along with the artery up to the ankle. At the ankle, it divides into a medial and lateral terminal branches. The lateral terminal branch, it ends in the pseudoganglion, which lies deep to the extensor digitorum brevis. The medial terminal branch ends by supplying skin in the first interdigital cleft and first dorsal interossei muscle. So muscular branches, these muscles, they supply the muscles of the obviously anterior compartment of the leg. So now I ask you I give you one homework for you. So find out what is nervous hesitance, or which nerve is called as the nervous hesitance and why. So this is a homework, you should finish it and come. So now we move on to the next topic, that is the dorsum of the foot. So the dorsum of the foot is nothing but this what we see, that is the anterior aspect of the foot or upper aspect of the foot. So let's see first the cutaneous innervation of the skin of the dorsum of the foot. It is supplied by 4 sets of nerves. So namely the superficial peroneal, deep peroneal, sural and saphenous nerves. So you can see here in the first picture. So this is a superficial peroneal nerve and this is a saphenous nerve. On the medial aspect, this is a saphenous nerve. So on the lateral aspect or in the middle, it is a superficial peroneal nerve. So this in the first interdigital cleft is the deep peroneal nerve, and lateral border of the foot we have a sural nerve. The next layer of the dorsum of the foot is a superficial fascia. So any superficial fascia, the content will be is a subcutaneous fat with the cutaneous nerves and cutaneous vessels. So here also we have a cutaneous nerves which are nothing but the branches of the superficial peroneal nerve and the saphenous nerves. Okay. So apart from that, you will see a network of cutaneous veins. So and this network of cutaneous veins, they form an arch. So this we call it as a dorsal venous arch. So this is a dorsal venous arch. From the medial end of the dorsal venous arch starts the great saphenous vein. From the lateral vein, it is the short saphenous vein starts. So this dorsal venous arch, it gives rise to several dorsal metatarsal veins. From the dorsal metatarsal veins, dorsal digital veins arises. So the dorsal digital vein, it drains the digit, venous blood from the digit, then it drains into the dorsal metatarsal veins, which in turn drains into the dorsal venous arch. Then we move on to the next layer of the dorsum of the foot is the deep fascia. So this deep fascia here is very thin and it is continuous with the plantar aponeurosis of the sole of the foot. So this deep fascia, it is modified to form an inferior extensor retinaculum. So we have seen 2 retinaculum now. 3 retinaculums are there in and around the ankle. In the anterior aspect, it is the extensor retinaculum. So we have superior and inferior, and that inferior extensor retinaculum, it is nothing but a modified deep fascia. So what are the muscles we see here in the dorsum of the foot? So it is the extrinsic tendon, that is the extrinsic tendons of the muscles of the anterior compartments of the leg, and intrinsic muscle is your the extensor digitorum brevis. So intrinsic muscle is the only muscle that is your extensor digitorum brevis. Apart from this, you will see the tendons of the anterior compartment of the leg which passes through the dorsum of the foot. So these are the contents. So muscle, the muscle is the extensor digitorum brevis. So what's the origin insertion of this muscle? So it is located in the lateral aspect of the dorsum of the foot in front of the lateral malleolus. So origin is from the anterior part of the superior surface of the calcaneus, and then what happens, it descends downwards and it gives rise to 4 tendons. So medial, and which go insert into the medial 4 toes. So the tendon to the big toe, it crosses the and insert into the dorsal surface of the proximal phalanx of big toe. Okay, so origin is from the anterior part of the superior surface of the calcaneus, where insertion, it gives rise to 4 slips. These 4 slips, it gets inserted into the medial 4 toes. Which surface? Into the dorsal surface of the proximal phalanx. So tendons of the second, third and fourth toes, they join the lateral side of the tendon of extensor digitorum longus. So the slips of the extensor digitorum brevis, second, third and fourth slips, it joins the lateral side of the tendon of extensor digitorum longus. Occasionally, the medialmost part of the extensor digitorum brevis, it may separate. Okay, it may separate and exist. It may separate and it gives us a separate slip. So nerve supply, again obviously like the anterior compartment of the leg, it is the deep peroneal nerve. Okay, action, extension of the metatarsophalangeal joints of the big toe and extension of metatarsophalangeal and interphalangeal joints of the second, third and fourth toes. So it's again the extension of, in the case of big toe, it is the metatarsophalangeal joints. Other toes, both the metatarsophalangeal joint and also the interphalangeal joints of the second, third and fourth toes. So this is about the extensor digitorum brevis. Artery of the dorsum of the foot is the dorsalis pedis artery. Already we have seen it is a continuation of the anterior tibial artery. So origin, it is a continuation of the anterior tibial artery and it arises in the front of the ankle. Then it runs forwards close to the medial side of the dorsum of the foot, enters the first intermetatarsal space. So then it dips downwards between the two heads of the first dorsal interosseous muscle and it enters into the sole, where it ends by anastomosing with the lateral plantar artery. So see this picture. So this is the dorsalis pedis artery. So which is nothing but it is a continuation of the anterior tibial artery from the in front of the ankle. So it descends downwards, then along the medial side of the dorsum of the foot. So you can see here it ends. That is, it ends by piercing dipping downwards between the two heads of the first dorsal interosseous muscle. So this is the first dorsal interosseous muscle, where it dips downwards and then enters the sole, where it ends by anastomoting with the lateral plantar artery. Relations. So superficially, it is related to skin, fascia, inferior extensor retinaculum, extensor hallucis, brevis tendon, crosses the artery from lateral to medial side. So deep to this artery is the ankle joint with its capsular ligament and dorsal bones. Medially, it is related to an extensor hallucis longus tendon, whereas the artery laterally, it is related to the first tendon of extensor digitorum longus and the medial terminal branch of the deep peroneal nerve. So these are the relations of the dorsalis pedis artery with the surrounding structures. So see in this picture, you can see this is the dorsalis pedis artery and the structures surrounding it. Branches. What are the branches of the artery? So it gives rise to a medial and lateral tarsal arteries. And there is one more artery called arcuate arteries, the third dorsal metatarsal arteries, and this in turn dorsal digital arteries to the adjacent toes. So with this artery, it ends by anastomoting with the lateral tarsal and the lateral plantar arteries. So the third branch is the first dorsal metatarsal artery. So these are the branches. The main branches is the medial and lateral tarsal artery. The dorsal metatarsal arteries, they are joined by the proximal and distal perforating arteries. So to this dorsal metatarsal arteries, the perforating arteries, they will come and join with them. So this is the picture. This is a dorsalis pedis artery, and these are the medial and lateral dorsal arteries. So with the this is an arcuate artery, and these are the metatarsal arteries and dorsal digital arteries. So dorsal digital arteries in the digits, metatarsal artery here, and finally this is the arcuate artery. So applied aspects, this dorsalis pedis artery, it can be used to feel the pulse. So artery pulse can be palpated in patients suffering from vaso-occlusive disease. Example is Berger's disease or Berger's syndrome. And this artery is congenitally absent in 14% of the cases. So dorsalis pedis artery being superficial, it can be used to palpate pulse, to check the pulse, especially in case of patients who are suffering from vaso-occlusive disease. Example, Berger's syndrome. So finally, we move on to the third compartment, that is the lateral compartment of the leg. So far, we have seen the anterior compartment. Along with the anterior compartment, dorsum of the foot we have seen. So finally, it is the lateral compartment of the leg. So this is the lateral compartment of the leg. This compartment lies between your anterior intermuscular septum and posterior intermuscular septum. So any compartment, what are the contents? So it is a muscle, vessels and nerves. Okay. So muscles are, so these are the boundaries. So whatever boundary, anteriorly it is the anterior intermuscular septum, posteriorly it is the posterior intermuscular septum, medially lateral surface of the fibula, whereas laterally it is the deep fascia of the leg. So this is the lateral compartment of the leg. So as usual, we go by layers. So first is the skin. Skin, cutaneous innervation, anterolateral aspect, it is by the superficial peroneal nerve. So what you see here, this is a superficial peroneal nerve, and so with the root value of L5 to S1. Posterolateral aspect, it is the sural nerve. Sural nerve with the root value of S1 and S2. So anterolaterally, it is supplied by the superficial peroneal nerve, whereas posterolaterally, it is by the sural nerve. So deep fascia, it forms the retinaculum. Here in around the ankle, it gets modified to form a superior and inferior peroneal retinaculum. So this is a superior peroneal retinaculum, and this is an inferior peroneal retinaculum, which is Y-shaped. Contents. Contents, as usual, muscle, vessel, nerves. What are the muscles? Peroneus longus and peroneus brevis. Vessel, it doesn't, this compartment will not have its own artery, but it is supplied by the branches of the peroneal artery, which is a branch of posterior tibial artery. And these vessels, they are accompanied by small veins, which drains into the short saphenous vein. Nerve is a superficial peroneal nerve. Okay. So once again, I repeat, what are the contents? Contents, as usual, muscle, vessel, and nerve. So muscles are two, which is the peroneus longus and peroneus brevis. Whereas vessels, it doesn't have its, this compartment will not have its own artery, but they are supplied by the branches from the peroneal artery. And these arteries, their branches they are accompanied by small veins, which finally drains into this more short saphenous vein. Nerve is the superficial peroneal nerve. So peroneus longus, you see, this is a peroneus longus muscle in this picture. It is superficial in location and bipinnate muscle. So origin is from the head of the fibula. So it's a lateral compartment. Obviously, the lateral compartment bone is the fibula. So it is from the head of the fibula and upper 2/3 of the lateral surface of the shaft of the fibula, both from the head and the shaft of the fibula. And also a part arises from the anterior and posterior intermuscular septum. So from the fibula, mainly the bone is a fibula, and also the intermuscular septum, anterior and posterior intermuscular septum. The tendon runs, so insertion, where it gets inserted, it runs superficial to the TB tendon, peroneus brevis tendon. So then through a groove behind the lateral malleolus, deep to the superficial peroneal retinaculum. So all these tendons will be passing deep to the retinaculums. Then it passes downwards and forwards deep to the inferior peroneal retinaculum. So initially it is a superior peroneal retinaculum, then inferior peroneal retinaculum, below the peroneal trochlea of the calcaneus. So in the calcaneus we have a trochlea, a bony projection. Below that it passes, then winds around the cuboid, passes through the tunnel. There is one osteofibrous tunnel in the cuboid. Then it crosses obliquely from lateral to the medial side of the foot. So though it is located on the lateral side in the foot, from the lateral side it crosses the foot and it reaches the medial side of the foot and gets inserted into the infralateral surface of the base of the first metatarsal bone and medial cuneiform. So finally, where it gets inserted, it is the medial cuneiform, infralateral surface of the medial cuneiform, base of the first metatarsal bone and medial cuneiform. So this is about the course and insertion of the peroneus longus. So origin is from the shaft, that is from the head and shaft of the fibula and the intermuscular septum. Nerve supply, it is a superficial, all these compartment muscles are supplied by superficial peroneal nerve. Action, this is the chief everter of the foot. So it causes eversion of the foot and it also maintains the lateral longitudinal arch and transverse arches of the foot. So these are the actions of the peroneus longus. Then we move on to the next muscle, that is peroneus brevis. So origin, you see here from the lower two-thirds of the lateral surface of the shaft of the fibula and also adjoining intermuscular septum, that is the anterior and posterior intermuscular septum. So where it gets inserted, the tendon, it runs in the groove behind the again lateral malleolus, then deep to the superficial peroneal retinaculum, lies in front of the peroneus longus tendon. This is a relation with the tendon. So above, now it passes. So whereas your peroneus longus tendon, it passes below the peroneal trochlea, whereas your tendon of the peroneus brevis, it passes above the peroneal trochlea of the calcaneum and then deep to the inferior peroneal retinaculum, then run forwards and laterally. So it will be running forwards and laterally and gets inserted into the base of the fifth metatarsal. Your peroneus longus, it is the base of the first metatarsal, whereas peroneus brevis, it is base of the fifth metatarsal. Nerve supply, as usual, it is a superficial peroneal nerve and action is eversion of foot and maintenance of the lateral longitudinal arch. So all these tendons, they maintain the arches of the foot. So we have 2 or 3 arches, medial longitudinal arch, lateral longitudinal arch and transverse arches. So the peroneus longus and brevis, they maintain the lateral longitudinal arch and also the transverse arches. So let's move on next to the muscle, then we move on to the next content is the superficial peroneal nerve. So superficial peroneal nerve, it is a terminal branch of the common peroneal nerve on the lateral side of the neck of the fibula. So this is the neck of the fibula. What you see here is a common peroneal nerve. At the neck of the fibula, it divides into a superficial and deep peroneal nerve. The superficial peroneal nerve, it enters into the lateral compartment, whereas your deep peroneal nerve, it enters into the anterior compartment of the leg. So what is its course? So as usual, it begins at the neck of the fibula, descends downwards between the peroneus longus and brevis, lies in the groove between the peroneus brevis and extensor digitorum longus. Then at the junction between the upper 2/3 and the lower 1/3, it pierces the deep fascia. So at this level, it pierces the deep fascia, enters the anterior compartment and divides into 2 branches. That is your medial and the lateral terminal branches. These 2 branches, they crosses the ankle and enters into the dorsum of the foot. So in the dorsum of the foot, we have seen, in the contents of the dorsum of the foot, we have seen the medial and lateral cutaneous branches of the peroneal nerve, superficial peroneal nerve. What are its branches? Then let's see what are its branches. Obviously, all this nerve, they give the muscular branches. Here also it gives the muscular branches which supplies the muscles of the lateral compartment of the leg. Then the cutaneous branch. So the cutaneous branches lower 1/3 of the lateral side of the leg and dorsum of the foot. So they supply the lower 1/3 of the lateral side of the leg and the dorsum of the foot. So medial cutaneous nerve, you see here 2 branches. The terminal branches is the medial cutaneous nerve. It divides into 2 dorsal digital nerves. So which supplies the medial side of this big toe and also the second interdigital cleft. Whereas the lateral cutaneous branch, it divides into again 2 dorsal digital nerves and they supply the 3rd and 4th interdigital cleft. So the first interdigital cleft is supplied by, it is a deep peroneal nerve. Whereas the remaining interdigital clefts, they are supplied by branches from the superficial peroneal nerve. Yes. So muscular branches and cutaneous branches. Applied aspects. So applied aspects, Talipus varus deformity. So talipus varus deformity, it is a deformity where the forefoot is deviated towards midline because of the paralysis of the peroneal muscles. So why the muscle gets paralyzed? Because of the injury to the superficial peroneal nerve or even common peroneal nerve. So because of the injury to the nerve, the muscles of the peroneal muscle gets paralyzed. So this deformity where the forefoot deviated towards the midline. Talipus varus deformity. There is one more deformity called talipus valgus deformity. So you see in this picture, this is a talipus varus and this is a talipus valgus. So what happened to the forefoot here? It is deviated away from the midline due to overactivity. This is because of the overactivity or spasm of the peroneal muscles. Okay. So one is talipus varus deformity due to paralysis of the peroneal muscles, and talipus valgus deformity. This is overactivity of the peroneal muscles. So this is a picture. This is how a talipus varus foot appears and talipus valgus foot. Sensory loss, obviously we have seen it supplies the lateral aspect and the first interdigital cleft and the dorsum of the foot. So there will be a sensory loss along the lateral aspect of the leg and the dorsum of the foot. So one more homework, so find out what is gyrobes and bursa anserinus. So gyrobes and bursa anserinus. So this is one more homework you need to find out. And second homework is the which nerve of the leg is called as the musculocutaneous nerve of leg. So three homeworks I have given. You have to, one is what is nervous hesitance, why it is called. Second is which nerve of the leg is called as the musculocutaneous nerve. And third one, what is gyrobes and what is bursa anserinus. So all this you should find out the answer. So next we move on to the retinaculum of the ankle. So retinaculum are nothing but these are the modifications of the deep fascia around the ankle. So all the deep fascia near the ankle, they get thickened to form a strong fibrous bands. So what is the function? Already we have seen it. Retains the tendons in place. It prevents bowstringing of the tendons during the movement of foot. So what are the various retinaculars around the ankle? Anteriorly it is the superior and inferior extensor retinaculum, whereas laterally it is the superior inferior peroneal retinaculum. Posteromedially it is the flexor retinaculum. So retinaculum, front of the ankle, these are the two. Superior extensor retinaculum and with attachments. So you see here, this pink color is a superior extensor retinaculum. It is 3 cm wide band located just above the ankle joint, running medially and upwards from the fibula to the tibia. Okay. So this is the inferior extensor retinaculum, this green color. You see in this picture, it is Y shape. So this is Y shape. The stem of the Y lies laterally, whereas the upper and the lower bands, it lies medially. Okay. So again, what you are seeing here is a superior extensor retinaculum and inferior extensor retinaculum. So what are the structures passing deep to the extensor retinaculum? So you have to remember the structures from medial to lateral. So this is the common mnemonic we use to remember the structures. Tall Himalayas are never dry places. Okay. So TA stands for tendon of tibialis anterior, H for tendon of extensor hallucis longus, A for anterior tibial vessels, and N for anterior tibial or deep peroneal nerve. Okay, D for tendon of extensor digitorum longus, and P stands for tendon of peroneus tertius. So this is the mnemonic which we use to remember the structures passing due to extensor retinaculum from medial to lateral. So these are the structures what you are seeing here, all the tendons. So from medial to lateral, these are the structures which passes deep to the extensor retinaculum. So now we move on to the retinaculum on the lateral side of the ankle, which are nothing but the superior and inferior peroneal retinaculum. So this is a superior peroneal retinaculum and this is the inferior peroneal retinaculum. So this is the inferior peroneal retinaculum. So let's see what are the structures passing deep to the peroneal retinaculum. Obviously the tendons of the peroneus longus and peroneus brevis along with the synovial sheath. So all these tendons, they will be surrounded by a synovial sheath. So they pass deep to the superior and inferior peroneal retinaculum. So in the beneath the superior retinaculum, it is both the tendons, they pass in a single compartment, whereas beneath the inferior peroneal retinaculum, the two tendons, they pass through separate compartments. The peroneus brevis tendon passes superficial to, so what is the relation here? Which lies superficial? It is a tendon of the peroneus brevis, whereas the tendon of the peroneus longus lies deep to it. Then retinaculum on the medial side of the ankle. So this is, we call it as a flexor retinaculum. Okay. So flexor retinaculum, anteriorly attachments. Anteriorly it is attached to the posterior border and the tip of the medial malleolus, whereas posteriorly it is attached to the calcaneal tuberosity. So let's see what are the structures passing deep to the flexor retinaculum. So we use this mnemonic: Tom, Dick and not Harry. So Tom, Dick and not Harry, we use this Tom, Dick and Harry. We use this mnemonic to remember the structures passing through the deep to flexor retinaculum. So again, from medial to lateral side, T stands for tendon of tibialis posterior and D stands for tendon of flexor discorum longus. A stands for posterior tibial artery and its branches. Then N stands for posterior tibial nerve and its terminal branches. Finally, H stands for tendon of flexor hallucis longus. So these are the structures which passes deep to the flexor retinaculum. So what the structures? This is a picture showing all these structures. You see, all the tendons are surrounded by a synovial sheath. So these are the tendons and the muscle. You see, you can see the tibial nerve and the posterior tibial artery. So find out what is tarsal tunnel syndrome. So in the upper limb, you have read about the carpal tunnel syndrome. Similarly, in the lower limb, you have one syndrome called tarsal tunnel syndrome. So you find out what is this tarsal tunnel syndrome and what happens and why the syndrome appears. So with this, we finish the anterior and lateral compartment of the leg and the dorsum of the foot. So you go and read. Any doubt you can ask. Thank you.